In the past 50 years, the frequency and impact of infectious disease outbreaks has increased dramatically, driven by factors like globalization, urbanization, and climate change. However, as many of you all know, these outbreaks do not affect all people equally. In many cases, minority groups who are already disadvantaged are more vulnerable to the harmful effects of infectious diseases. One such group is people living in informal settlements, or more commonly known as people living in slums. However, the term is debated, so we'll just stick to informal settlements. This raises the question, are people who live in informal settlements more impacted by epidemics or pandemics than those in formal settlements? Today I'm going to break down an empirical economics paper that examines this exact relationship and try and make it accessible to economists and non-economists alike. The fun fact about this is my paper, so this is my undergraduate thesis, and I thought I'd start off by trying to examine a paper that I know very well and talk about a lot, as many people in my life will already agree with that statement. So, let's get right into it. The gripingly titled paper, Informal Settlements and the Prevalence and Deadliness of Infectious Diseases, a case study from Liberia, Sierra Leone, during the 2014 West African Ebola outbreak, examines the causal relationship between informal settlements and disease, or in this case, Ebola. So depending on when you were born and your epidemic knowledge, if that's a word, you'll know a little bit more or a little bit less about Ebola, but I thought I'd just cover a little bit to kind of help you grasp if you don't know. Otherwise, feel free to skip. So, the Ebola virus disease, or what we're now going to call Ebola, was discovered in the 1970s in DRC on the Ebola River, hence the name. And it's had quite a few outbreaks, but the largest outbreak was the 2014 West African Ebola outbreak affecting Sierra Leone, Guinea, and Liberia predominantly. So a massive outbreak with nearly 30,000 cases and over 10,000 deaths. So a highly transmissible disease and very, very deadly. The disease can be transmitted through two mechanisms. So there's the cross-species mechanism, which is basically from an animal to another animal, or an animal to a human. Or there's the human to human, which is basically your standard pandemic and epidemic in the way you think of disease. So when the Ebola outbreak was happening, there was huge coverage about the zoonotic or animal where it came from, with lots of sources stating that it's from primates, so either chimpanzees or gorillas, or some people saying that it came from small terrestrial vertebrates. However, a recent study found that some outbreaks can be traced back to free-tailed bats in Guinea. So that kind of narrowed it down, however, it's still up in the air. But an interesting and very pivotal point is the human-to-human transmission. And so this is a human-to-human transmission is when a human comes in contact with an infected or deceased patient's blood or bodily fluid. So literally just through contact you can get Ebola. So this made it a super, super difficult epidemic to contain and stop the transmission. And it definitely would have been a lot worse if the global response wasn't super coordinated and super well planned out, which we'll come on to because that plays a big role into analyzing the effects of the disease on informal settlements. But for now, let's switch over to informal settlements and analyze the characteristics that can potentially describe how we would think disease interacts with residents of informal settlements. So, the tricky thing about informal settlements is it's kind of hard to quantify what an informal settlement is. When does an informal settlement become a formal settlement? What type of characteristics? Is it infrastructure levels? Is it rights? Is it security that defines informal settlements? So that was kind of a hurdle that had to kind of be circumnavigated, which I'll explain in the data section. But also another part of informal settlements is why they start. What's the reason informal settlements spring up in cities? And the predominant theory is that informal settlements are basically a response to people who are predominantly living in agricultural settings who want to move to a city to find employment levels that provide higher income than they would in the countryside. The first characteristic of informal settlements that might have an impact on the spread and deadliness of an infectious disease is the high food and water insecurity. This affects variables like malnutrition, where residents of informal settlements tend to have extremely low levels of caloric intake compared to what they need to have to remain healthy and to be able to fight off disease effectively. Also, residents of informal settlements, due to the lack of food security, will be more likely to consume wild meat and like game than this, like for instance, like Ebola, opens transmission mechanisms from wild species, increasing the chances that outbreaks occur in informal settlements. And there's a similar pattern where, because of the lack of water security, the water tends to be not as clean, and so that also opens vectors for waterborne diseases like cholera. The second characteristic is the access and want of health care. A significant problem faced in the reduction of disease transmission in informal settlements is the lack of trust in healthcare institutions and the lack of access because of income. A big problem is the fact that residents of informal settlements tend to have a lack of trust and a lack of belief in Western medicine and the organizations that provide it, and will therefore consult a traditional healer in their informal settlement as opposed to going to a hospital or a set-up kind of testing center. And the problem is these traditional healers, their methods are less effective, and also they are not taking the proper precautions to stop the spread of disease. And since they see other patients, it actually turns into a transmission event that makes the problem worse. It exacerbates the spread of infectious diseases like Ebola in the informal settlement. The final characteristic is the cramped living spaces. I think without COVID, this point would be more difficult to understand, but basically since we've all been through isolation policies and stuff like that, it's very easy for us to grasp the way public health is treated and the way a response to disease is implemented. And so the problem with informal settlements, when the disease and infectious disease comes in and isolation measures are put in place for those infected, it's very difficult because they live in such cramped, multi-generational spaces where they don't even have the space to isolate, and also they don't have stable jobs that have policies that allow them to get paid whilst they're on medical leave. So for many people, it's just not even a possibility. They need to go work. They need to provide income to their family. They don't have time to isolate, and this just rapidly spreads the disease, and also it makes them more likely to die from the disease because they're not resting, they're not going to proper institutions. And so that's another huge factor why informal settlements have kind of this limited ability to deal with infectious diseases, which increases the transmission. So there's more cases and there are more deaths. And so based on all the information we've just gone through, it's quite easy to form a hypothesis that is the basis for the empirical paper. And the hypothesis is that residents of informal settlements are disproportionately affected by infectious diseases, either through the fact that there's more cases per capita in the area of informal settlements, and also there's more deaths per capita in the area of informal settlements. And so now that we have our hypothesis, we can go on to the empirical section of testing this and seeing what we find out through regression. And I know regression is kind of a bit of a scary word for people, even for people studying economics, but I do urge you to kind of just try follow through. It's quite visual because there's a lot of geographical data that I had to do. And so it's quite intuitive, and I'll try go through it super duper slowly and, try be taught the way I wish I was taught, because I did have to figure a lot of this stuff out by myself. Before I get into the data, I just wanted to give a quick shout out to two websites that kind of really helped me. And if you're kind of in a sticky position trying to write a dissertation in developing economics, I'm sure there'll be something for you. So basically, I got all my slum data from this NGO called Slum Dwellers International, SD, you can see on the photo. And then I got all of my kind of mapping stuff from HDX, which is OCHA's data service, which even in my job now, I use pretty much daily. So really, really good data websites that if you need some stuff on international development stuff, that's the place to go for sure. So let's move on over to our data map. So we basically have Sierra Leone and Liberia. Unfortunately, I couldn't get slum data from Guinea, so it's not included in my analysis. But basically, we have the administration levels for both of them. And as you can see, they're kind of different levels of administration, which was kind of a problem, but we got around it in a little nifty way because we actually had to do something. There. So now we want to find out for our analysis the cases and deaths per capita in all the formal settlements and all the informal settlements across the two countries. So first step is you kind of just throw all of your cases on. So they're geocoded cases with coordinates, and you throw them all on the map. I'm just going to zoom in on the capital here, and the kind of triangle dots represent more than one case, and the singular dots represent a case. And that carried off with a ton of data, so really great work from WHO and the people on the ground that just collected amazing data. So now we need to figure out if these cases are in slums. So basically, I found the locations of the slums, I plotted them, and then using kind of a tool, I buffered the area of the size of the slum based on its predicted population. So if we just add the slums now, we have them. So all the red dots represent the slums in the city, and basically if a case falls within that, it's a case that's now in an informal settlement versus a formal settlement. So now we have all this, and you have like a bunch of data, and you can just use a bit of coding. Super duper easy, not too much. But the problem is your settlement types are different sizes. So the informal settlements are very small, but then the areas for the formal settlements are massive. And a way you have to get around this is by gridding. So you buffer in a bunch of grids. Let's just remove the admin layer. And basically now, each grid is throughout the whole country. It looks a bit crazy when you zoom out. But anyway. And basically what you do is you find out what proportion of the grid is an informal settlement. So for instance, this one here, I can't tell you off the top of my head, but maybe that's 10% informal settlement, and it looks like it's got more than one case in it. And so after you buffer in all the population density data, which you can get from OCHA's data service, you basically have in every grid the cases per capita and the percentage of it that is potentially a slum. And we're going to get into it in a little bit, but I'm just going to quickly mention it so it doesn't get crazy later. But basically, I had to import in the low-skilled job opportunities. So in this tab here that I've got titled Mangroves, it actually includes the factories and also the ports and railways. Don't worry, I'll explain it in a second. But anyway, so that's all that. And then I had to buffer around them. So then use a buffering tool, which basically means like you have every point has a circle made out of it and it makes it bigger. And that's the area of low-skilled job opportunities. And then with the grid, you can kind of see how I did that. But anyway, that's pretty much all the data. And you end up with these lovely rows of just cases and deaths per capita and the percentage of the grid that is a slum. Now that you have all your perfectly clean data, you can move on to your estimation strategy, which basically means how can you test your hypothesis effectively by factoring all the things that could mess your hypothesis up using the data you have. So basically, economists use this thing called OLS. It's a type of regression that's like the base sample. And it's the best one to use if these 5 assumptions hold. They're not really relevant, but basically they're strawman assumptions. They're kind of made to be broken. In any study, you're not going to find one where the assumptions aren't broken. They're pretty weak, you know? And so in my one, 3 of these assumptions were broken. And so I incorporated these 3 types of econometric fancy things that I'll try to explain. They get a bit more complicated as they go on, but I'll try to explain them very simply and intuitively. The first one was control variables, and these correct for unobserved variables. So basically, what are things in disease transmission that are unobserved by informal settlements? And the kind of one that jumps out to you is population density. So if, let's say you hypothetically have this disease, you'll assume that it spreads quicker if there's 30 people in a room versus 30 people in a whole country. You know, there's more contact traces, there's more contact points, there's more human-to-human transmission events, more likely. So you have to control for population density to basically find out the difference between the settlement types and the spread and deadliness of disease. The second econometric trick that I had to implement was something called fixed effects, and this basically corrects for geographical differences. So thinking about a response, it's all different in the different parts of each country, it's different in each country. So I basically had to incorporate these things called fixed effects for subnational domains. So, big scary word, but basically it's just, if you're in the States, it's like fixing your state. You're looking at the thing within the state, or if you're in the UK, your county. And it's like one level down from your country. And it's kind of just ADM01. And I also had to fix for ethnic groups. So a big problem faced in the response to the Ebola outbreak was how to manage burials. So a lot of religious groups in the countries have a practice of washing their dead before they bury them. And if you were listening during the Ebola section, there's a transmission mechanism when you touch a deceased patient of Ebola, you are likely to get it. You're actually even more likely to get it than if they were alive. And so by fixing for ethnic group, I'm trying to incorporate the fact that some of these places will have this ritualistic burial where they wash the dead and some won't. And you have to fix that because that really affects the transmission of the disease. And the last one, which is kind of the big, bad, scary wolf, is something called instrumental variables. And this basically just means if your X variable, like in my case, settlement type, is not random, you have to do this whole other step. And so when I was thinking about informal settlements, they're not in random places. They're in cities, but they're in specific areas. And like I mentioned, they're by low-skilled job opportunities. So I had to factor in low-skilled job opportunities and if a slum was in the proximity of them to determine to make X not like to incorporate the non-random element of my X variable. So that's the thing called IV. For my instrumental variable, I was accounting for the low-skilled job opportunities, and it's kind of hard to find where every single low-skilled job opportunity is, but I had to kind of do a bit of history research and find out when slums started, what were the opportunities people moved to these cities for, and if I could find data on them. And so basically that meant that I was looking for these 1970s low-skilled job opportunities that were listed on the slums. And I came to like 3-4 main types of jobs. The first two were low-skilled job opportunities by transport sectors. So that was basically the people who manually helped carry cargo and stuff at train stations and ports. So I plotted those on a map. Those were done. The next one was people moving to cities for low-skilled job opportunities in manufacturing sectors. So I had to find a list of the 1970s manufacturing factories in the city. And this was kind of really supported by the slums and looking on the NGO website, because some of the slums were called like Tin Can Factory. And that basically meant that the slum was next to a tin can factory and a lot of people moved there to work in this factory. And the last one was on a similar thing where it was, I kind of figured out through the NGO website of the slums. And it was basically, a lot of them would be called after these small mollusks and clams and stuff like that. And basically, a very low skill, low startup cost type of job in these cities is foraging and fishing in mangroves, which are very shallow water, so you don't need to buy a boat, and they're very, low cost, and anybody could kind of do them. And so I had to find the mangrove areas and plot those on a map, because people would go fish in these mangroves. Now you have all these points of low-skilled job opportunity. The slums are going to be in an area around them. So you basically have the point and you draw a circle, and I kind of looked at kind of commuting ability of residents of informal settlements and basically buffered around, I think it was 5 kilometers or 1 kilometer around the low-skilled job opportunity. And that is like a decent interval where I would expect to find slums, because it's not a non-random variable. And so you incorporate that and you do your whole regression and you end up with your results, which we're just going to dive into now. Just in editing here, I forgot to put the final equation that tries to estimate the causal effects between the two. So I was just going to shove it up right here for those who want to know. Otherwise, keep enjoying. Now on to the long-awaited results, and I can't tell you the stress I had when waiting for the code to run and waiting for the table to pop up and seeing if it's significant or not. So I'm just going to pop the two results tables up, just hopefully here. And I was just going to briefly talk through them, because if you haven't looked at an economics paper, or I guess maybe a scientific paper, you won't really get what's happening here. But basically, for table 3, settlement type and the prevalence of Ebola, which is basically the cases per capita of Ebola, you want to look at settlement type and cases per capita. So the top right thing. And what you can see is it says 0.0077, and underneath it, it says 0.012, and that's the standard error. And basically, since it's not half, it's not a significant result. So basically, it kind of came out that the settlement type didn't have significant effects on the cases of Ebola. So if it was significant, what it basically means is per person, there would be 0.0077 more cases. And so, but it's not significant, so you can't make that conclusion that settlement types have an effect. And if you look on table 4, the same place where it's settlement type and deaths per capita, it has 0.0036 and then a standard error underneath it. And so that too isn't significant. So unfortunately, after all that work, there wasn't significant results, but that's kind of the way undergraduate theses end up. It's not so much about the results you find, more just about the way you look at them. It's kind of a practical study. But the good thing about it is if you look at table 3 again, and you look at LSJO, low skilled job opportunities, and you look across, it's 0.0098, and it's got 3 stars, which basically means it's significant. So the instrument of slums being predicted by these low-skilled job opportunities was good, and it works really well. And if you want to look at a bunch of other validity tests, I have them. They're a bit more like fancy level if you want to just read the paper. But a kind of a very simple one to understand and think through that you could just do by yourself is thinking about the way low-skilled job opportunities work. The way it is, and based on sources, the employment style in informal settlements is that it tends to be that the men will go outside the settlement if they ever do, and they're the ones working outside, where women find employment within the settlement. And so this basically means if there were men outside and working in these cramped locations, you would kind of expect that they would have higher transmission rates than women. And I'm just going to pop up table 6 here. And this table basically just shows that there isn't significant differences between men and women's transmission rates. And that kind of proves the fact that slums are predicted by these low-skilled job opportunities, whereas even though it's not significant, it's kind of helping us understand the way this is spread and the way low-skilled job opportunities are affected. And so that was like a really, really positive thing I got out of this study, is that you can kind of determine where slums are going to be based on low-skilled job opportunities. But anyway, if that was kind of like weirdly worded, feel free just to read the paper. I spent a lot more time just writing it out and trying to make it clear. But anyway, so now that we don't have, a story, we don't have a story that informal settlements have different rates of disease or different deaths of disease in terms of Ebola and in terms of the 2014 outbreak. We have to start thinking about alternative accounts. So what's the story? What can we, get out of this? And on the one end, you can just be like, there's no significant results. You can't really get a story out of it. And then, or you can just kind of try think of a story and go, okay, why am I not seeing the difference? I know based on, research that I would expect to see a difference, but how can I kind of describe the fact that there isn't a difference? And I mentioned this before when I was talking about Ebola, which was the global response and the strategy to mitigate the effects of Ebola. And this was kind of a theory I came out with, which was because you don't see the differences, you kind of can go, maybe it was because of the global response and the measures put in place that it kind of evened the playing field, and it meant that the disease affected people in informal settlements and settlements the same. And this was through kind of policies like they set up lots of mobile hospitals near slums and isolated really well, and they targeted slums because they knew that it was kind of a weak, marginalized group, and they want to make sure that the disease isn't disproportionately affecting them. And so to kind of test this theory, I'm just going to pop up table 7, and that's just going to go up here as well. And I kind of did this through testing hospitalization in settlement types. And so if you assume that there wasn't a big global response that was measured really, really well, you would kind of assume that people in slums wouldn't have as much access to hospitals as people out of slums. But the test shows that there wasn't a difference. People who were in informal settlements and people who weren't had the same access to hospitalizations per case. And this basically just means that people, like the effects that are drawing out my hypothesis that people in informal settlements will be disproportionately affected, because of the global response, they're just not there. They've been mitigated. The effects that have drawn my hypothesis are just not there. And so this is one potential, takeaway, that because of the efforts by organization, by the governments, by, the procedures they put in place, they actually mitigated the effects on the people most marginalized, which is like a great story to just kind of think about, that when these policies are put in place to protect the most vulnerable people, it might have actually worked. It might have done such a great job, which is like a great takeaway to, kind of come out with. And so I'll just kind of go on to some limitations and some kind of concluding points to try sum up this video and try sum up the study. So now that we kind of have a narrative about the outbreak and potentially a reason why we don't have significant effects between settlement types like we predicted, it's kind of just a good idea to kind of try think through the limitations of this paper, because there definitely are. It's an undergraduate thesis. I spent, I guess, a year doing it and it was me alone with my supervisor. Shout out to him. He had so much help, so that was really great. But also, it's kind of just like a test of your practical skills. So there definitely were limitations, and I kind of just want to pop them up on the screen and just try to talk through them. And the kind of first limitations is I was getting my slum data from this organization that is funded, externally, and it's not, a huge organization. It's kind of volunteers going out to slums and measuring, their infrastructure and stuff like that. So they definitely don't have the capacity to test and go to every single slum. So that's definitely a thing where you're not accounting, because maybe there were a lot of clusters of cases that fell under formal settlements that should have been informal settlements, and maybe that's the reason we didn't get results. I guess, which we'll never know. Another kind of limitations is their definition of a slum. It's going back to the thing where it's like, what makes a slum or informal settlement an informal settlement? What's the difference? And since it's like not this black and white thing, it's really hard to get a grasp on what's the breaking point. When does one become another? So that's definitely a limitation when looking at the study, because the study just views them as a 0 or a 1. And the next one is kind of just the reverse causality. It's the last kind of problem where there's a reverse causality relationship between disease and slums, where basically having diseases and being sick makes you less able to work. It reduces your income and impoverishes you. And so it's kind of like a backwards motion of the effects. And that could have diluted the effects. It's like another problem. But I was just, it was a great paper to do, and I really loved it. And it was like a super big passion of mine for so long. And so I think I got some good concluding points where, the response to disease outbreaks is super key, and an organized and thought out and fair way to deal with these is a super vital thing. And also I hopefully kind of drew a bit of attention to the need for more monitoring and data on informal settlements, and kind of the understanding of informal settlements and the way they interact, because these are, huge populations. They're not like 10% of the population. They get massive in some of the cities around the world, like in Brazil and, in their favelas. And so it's definitely like a really important thing to understand the way informal settlements work. Thanks for getting to the end of the video. Hopefully you really enjoyed. If you have any questions, feel free to leave a comment below. I'll try to get back to you. And also, if you want to read more, I'll try to link the full working paper down below. But apart from that, have a good day.